Welcome to Part 1 of the mindray D3 Defibrillator training series. In this video, you will be given an overview of the features and learn how to power and charge the device. The D3 Defibrillator is a portable device with 4 modes: manual defibrillation, monitoring, pacing, and semi-automatic defibrillation, known as AED. The D3 can operate from both AC mains power and from its battery. To power and charge the D3, first ensure the battery is inserted correctly. Then connect the power cable to the AC port on the back of the device and switch on at the wall. The following symbols indicate the power and charging status. The green wave icon illuminates when the device is plugged into AC mains power. The yellow battery icon illuminates when battery is charging. The green battery icon illuminates when the battery is fully charged. If no battery is detected, no battery icon will be seen. When a red cross is illuminated, this could be due to a device failure or because the battery has been removed. Check the battery and conduct a device test procedure, which is explained in the next video. If the error persists, contact your medical engineering department. The green tick indicates the device is functioning correctly. Now we will familiarise ourselves with the physical features on the front of the device. An alarm lamp can be seen at the top of the device. Alarms can be both audible and visual, and will change in colour, tone, and frequency, dependent on the urgency of the alert. Lead Select button, to change the ECG view. Gain Select button, to adjust the size of the ECG trace. NIBP button, to begin a non-invasive blood pressure. Alarm Pause button, to pause, reactivate, or switch off alarms. Mark Event button. Main menu button. Navigation dial, to operate the screen. Soft keys, with changeable functions. Mode dial, rotate to turn the device on and select a mode. Energy select buttons, to adjust energy levels during manual defibrillation. Charge button, to begin charging for a shock. Shock button, delivers the shock. The therapy port is where the patient's shock cable is connected. To apply the cable, align the green arrow and push. To remove, rotate clockwise and pull. To monitor a patient, insert the relevant cables into the ports on the side of the device. Your device configuration may vary and may not have all options displayed here. The D3 has an integrated recorder or printer. Press the button on the printer to start and stop printing the current readings. A green LED will illuminate when the recorder is functioning correctly. If it's flashing, the recorder has run out of paper. To change the paper, open the recorder door and insert a new roll as shown. That's the end of Part 1. Thank you for watching. Welcome to Part 2 of the mindray D3 Defibrillator training series. In this video, you will be shown how the automatic and manual device testing procedure works. The D3 will automatically perform an automated, routine self-test at 3 AM every morning to ensure the device is functioning correctly. If the device passes the self-test, a green tick will be displayed. If the device fails the routine self-test, a red cross will appear. this occurs, perform a manual test. If the device fails again, contact your medical engineering department. To perform a manual test, the device must be connected to mains power. Next, ensure the device is clean and all cables are intact with no breaks. If damaged cables are found, do not perform the test and contact your medical engineering department. Connect the shock cable to the test plug. Turn the mode dial to monitoring to power on the device. Press the main menu button. Using the navigation dial, highlight and select User Test. A message will prompt you to end patient monitoring and enter the test menu. Select Yes. Once in the test menu, ensure Routine Test and Energy Delivery Test are both selected. Select Start Soft Key when ready to commence the user test. A warning message will be displayed to ensure paddles or pads are not connected to a patient. Select OK to confirm and continue. During the test, the user is required to push the yellow charge button and the shock button when prompted. The device will now request to repeat the process using the battery. Follow the on-screen instructions. In the final stage, a prompt screen will ask the user to continue the test if using paddles. In most cases, you will not be using hard shell paddles, so select Cancel. The device will now display Test Completed. After the test, the soft keys provide 3 options: Transmit, Record, or Return. Press Return to complete the test. If the device fails the test, a red cross will appear on the front of the device. If this occurs, repeat the test. If the device fails again, contact your medical engineering department. A green tick will be displayed if the device passes the test and is functioning correctly. Once the user test is complete, press Exit and turn off the device. For further information about your hospital's policy for testing defibrillators, please contact your resuscitation department. That's the end of part 2. Thank you for watching. Welcome to part 3 of the mindray Benihart D3 defibrillator training series. In this video, you will be shown how to use the AED function. AEDs are to be used on patients who are for resuscitation, non-responsive, not breathing, or not breathing normally. To deliver automated external defibrillation, follow these steps. Remove patient's clothing around chest. Wipe any moisture from the chest. Clip or shave any excessive chest hair. Attach the pads to the chest as shown on packaging. Use a standard anterior lateral placement position. If not already connected, connect the pads to the patient's shock cable. Next, turn the mode dial to AED.
Apply pads.
The D3 checks if the pads and shock cable are connected. If not, the message Apply Pads will appear on the screen. There is the option to change the patient category between adult or pediatric using the navigation dial.
Analyzing now. Do not touch patient.
Once an ECG trace is detected, the device automatically analyzes the patient's heart rhythm and warns the user not to touch the patient.
Shock advised. Charging.
If a shockable rhythm is detected, the D3 automatically charges to a pre-configured energy level.
Do not touch patient. Press the shock button.
Follow the device's voice and visual prompts. When ready, press the shock button.
Shock delivered. Paused. If needed, begin CPR.
After delivery of the shock, follow on-screen instructions. An audible metronome tone is to assist with CPR delivery. To adjust the volume, press the soft key. If the user does not wish to deliver a shock, the device will automatically disarm after 30 seconds.
Analyzing now. Do not touch patient.
If a non-shockable rhythm is detected, the device will not charge.
No shock advised. Paused. If needed, begin CPR.
Follow the audible and on-screen instructions until a senior clinician or responding emergency team arrives. After the rescue, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. That's the end of part 3. Thank you for watching. Welcome to part 4 of the mindray Benihart D3 Defibrillator training series. In this video, you will be shown how to use the manual defibrillation function. To prepare the patient for manual defibrillation, remove the patient's clothing around the chest. Wipe any moisture from the chest. Clip or shave any excessive chest hair. Attach the pads to the chest. Use the standard anterior lateral placement position. If not already connected, connect the pads to the patient shock cable. Next, turn the mode dial to manual defib. In manual defib mode, users can see an ECG waveform, a heart rate display, a CO2 waveform, CO2 numerical information, an impedance indicator, a defibrillation information window. There is also an elapsed timer, clock, and battery status indicator. Users are also able to change the patient category from adult to pediatric or neonatal. To begin delivering a shock, select the desired energy level using the Energy Select buttons. For adults, users can select energy outputs of 200, 300, and 360 joules. To charge, press the charge button. Once charged, the user will hear a change in tone and see a flashing shock button. When ready and it is safe to do so, push the flashing shock button to defibrillate the patient. To help ensure successful defibrillation, an impedance indicator can be seen on screen. A green light indicates an acceptable level of impedance. Amber and red lights indicate that impedance is too high. Users should not delay delivery of the first shock regardless of the impedance. After the first shock, high impedance can be reduced by checking the pad positions and cables connections. Changing the pads should also be considered. To use CO2 monitoring, select the appropriate filter line and twist clockwise into the adapter port. CO2 monitoring will automatically display and auto-zero once connected to the patient. Push the event button to manually mark any significant events. Select a choice or generic from the menu. After the rescue, an event summary can be printed by accessing the menu and Others submenu. Clinical information can also be reviewed by accessing the Archives menu. pre-configured events will automatically print. To print manually, press the Start-Stop button. After the rescue, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. That's the end of part 4. Thank you for watching. Welcome to part 5 of the mindray D3 Defibrillator training series. In this video, you will be shown how to use the synchronized cardioversion function. Prepare the patient for therapy in the same way as directed in part 4 of this training series. Apply the electrode pads and ensure a good contact. Connect the pads to the patient's shock cable. Turn the mode dial to manual defib. Select the desired energy level. Energy levels for cardioversion are determined locally for broad and narrow complex tachycardias. To ensure safety during cardioversion, synchronize the shock with the R wave by pressing the Enter Sync button. Confirm using the soft key. Once performed, white markers will appear above each R wave, and a green sync label will be visible on the screen. To charge, press the Charge button. When ready, and it is safe to do so, push and hold down the flashing shock button until Shock Delivered is displayed. For subsequent shocks, please ensure the white markers are visible. If not, press Enter Sync again. To disarm and not deliver a shock, press the Disarm button. To help ensure successful cardioversion, an impedance indicator can be seen on screen. A green light indicates an acceptable level of impedance. Amber and red lights indicate that impedance is too high. Users should not delay delivery of the first shock regardless of the impedance. After the first shock, high impedance can be reduced by checking the pad positions and cable connections. Changing the pads should also be considered. After the therapy, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. That's the end of part 5. Thank you for watching. Welcome to part 6 of the mindray D3 Defibrillator training series. In this video, you will be shown how to use the external pacing function. Fixed mode pacing delivers a pacing pulse at a selected rate, independent of the patient's own heart rate. Fixed mode pacing can also be used when a poor R-wave progression is seen or if a 3-lead ECG cable is not available. In demand mode, the D3 will deliver a pacer pulse, where the patient's heart rate drops below a specified rate. Demand mode is the preferred pacing mode of clinicians, and will be the focus of this training video. Prepare the patient for therapy in the same way as directed in part 4 of this training series. Apply the electrode pads, and ensure good contact. Connect the pads to the patient's shock cable. Turn the mode dial to pacer mode. Lead 2 is automatically displayed in the ECG waveform area. A white marker will appear above each detectable R-wave. If the R-wave markers do not appear or do not coincide with the R-waves, select another lead. Change the pacer rate by pressing and rotating the navigation dial. Press the navigation dial to select the desired rate. Pacer output is adjusted in the same way. When pacing, the message "pacing" will appear. On-screen pacing spikes show that pacing is activated. Electrical capture is indicated when a pacing spike is immediately followed by a broadened QRS complex. The ECG rate will increase to match that of the pacer rate. It is recommended to check the patient's pulse at this point. To review the patient's ECG rhythm, press and hold the 4-1 button. For safety, a pacing spike will still be delivered every 4th beat. To resume pacing, release the 4-1 button. For advanced functionality, select the Screen Unlock button and follow prompts on screen. After the therapy, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. That's the end of part 6. Thank you for watching. Welcome to Part 7 of the mindray D3 Defibrillator training series. In this video, you will be shown how to use the monitoring functions. To use the monitoring mode, ensure all relevant monitoring cables are connected to the device and attached to the patient. Turn the mode dial to monitor. To navigate the screen, rotate the navigation dial and press to make a selection. Select the required patient type. Choose from adult, pediatric, or neonatal. When the ECG cable is attached to the patient, the ECG waveform and heart rate automatically display on screen. To view alternate ECG leads, press the Lead Select key. To adjust the size of the ECG complex, press the Gain Select key. Further ECG options are available by selecting the on-screen heart rate values. When the SpO2 sensor is connected to the patient, the oxygen saturation level, an SpO2 pleth wave, and arterial pulsation bar and pulse rate automatically appear on screen. Further SpO2 options are available by selecting the on-screen SpO2 value. To take a non-invasive blood pressure, apply the correct size blood pressure cuff to the patient. Begin the reading by pressing the NIBP button. Further NIBP options, such as intervals and continuous NIBP, known as STAT, can be accessed by selecting the NIBP value. STAT NIBP will take readings continuously for 5 minutes. To monitor CO2, insert the adapter and connect the appropriate filter line. CO2 monitoring will auto-zero and auto-display once connected to the patient. CO2 information includes the waveform, the end tidal CO2 value, fraction of inspired CO2 value, and an airway respiration rate. Further CO2 options are available by selecting the on-screen CO2 value. Alarm settings can be seen on screen, displayed next to each parameter. To change alarm settings, use the navigation dial and select the desired parameter. In the menu, select Para Alarm and configure the alarms as required. To configure ECG arrhythmia alarms, select the ECG heart rate value and then arrhythmia. Alarms are both audible and visual. Alarms will change in colour, tone, and frequency, depending on the urgency of the alert. A warning message will be displayed on screen when an alarm sounds, and the corresponding value will flash. Push the Alarm Pause soft key to temporarily deactivate the alarms. Push the soft key again to reactivate the alarms. To reset alarms, push the Alarms Reset soft key or restart your device. To review on-screen information in real time, push the Freeze soft key. Push the Unfreeze soft key to return to standard monitoring. Patient trends are automatically recorded. To view trend data, push the Trend soft key. Push the Main Menu key to return to the home screen at any time. Press the Record key to start recording and again to stop. When you have finished monitoring, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. That's the end of part 7. Thank you for watching.